it's been quite a while that we've been working together in the pandemic. So it is time, hopefully, for us to look forward, to reflect on some of the lessons learned, and to develop action plans to how we can continue to sustain the actions and resources that we built through the pandemic forward. So before we start, we would like to welcome our nominated principal investigator, Dr. Josephine Wong, who will do an acknowledgement and also give us some background context of the work that framed the forum planning today. So welcome, Josephine.
Good afternoon, everyone. On behalf of Project PROTECH, we will begin by acknowledging our privilege of working on Indigenous land in Takaronto. The Mohawk word Takaronto means the place in the water where the trees are standing. It refers to the wooden stakes that were used as fishing weirs in the narrows of local river systems used by Indigenous peoples for thousands of years, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. Today, Takaronto continues to be the home to many diverse First Nations, Inuit, and Métis people. Our team is committed to work in solidarity to address the ongoing impact of colonialism, racism, structural violence, and other forms of social injustices that disproportionately impact Indigenous peoples, Black peoples, and racialized communities in Canada and across the globe. Today is the last day of the Asian Heritage Month in Canada. We are taking this opportunity to engage in reflection, dialogue, and collective aspiration to advance social justice and health equity. 28 months ago, we came together to design PROTECH, the Pandemic Rapid Response Optimization to enhance community resilience and health. Our aim at the time, based on lessons learned during the SARS pandemic, was to reduce the negative psychosocial impact of the COVID-19 pandemic on Chinese Canadians and other affected groups, including frontline healthcare providers. At the same time, we wanted to promote community resilience. We brought together a team of 8 researchers and 14 collaborators within a few weeks. To a great extent, the PROTECH team is proud to share that we have achieved many of our objectives. Along the way, we have also gained many insights about the pandemic and crisis response. Here I have put together a number of pictures that together describe what we have done through PROTECH. PROTECH website is a community information hub that at the beginning, it contains information about the pandemic, about how it is passed from persons to person or in the communities, what we can do to prevent it. As the pandemic progressed, we had also changed information in response to what's needed in the communities. At the beginning, we had live chat so that people who are not able to obtain certain type of information and they had questions, we actually had trained many volunteers, close to 100 volunteers to actually staff those live chat lines. And people can also call in if they were not able to type in the information. As the pandemic progressed, we also started other kind of strategies. Along the way, the staying healthy is a set of resources that have been used by many people who visited our website. We had the PACER training that built capacity and also addressed the mental health challenges and needs of Chinese communities, Asian communities, as well as frontline service providers. Then we had the community partner showcase that we bring stakeholders together so that they can actually share the kind of wise practices that they had adopted during the pandemic. And those become really a lot of information and wisdom for other service providers and community stakeholder who wants to know what is happening. Then we had the resilience dialogue that actually brought together stakeholders, people with lived experience, people with professional experience, people with certain expertise to respond to the emerging issues that are critical to the communities during the pandemic. And all this now have been posted on our YouTube website. In this slides, I'm just showing some information. We had other outcome indicators that we will talk in other sessions and through other means. But here you can see that we had picked 4 periods of time and just look at our data to see who has been visiting our resource hub. And at the very beginning, we were reaching over 3,700 people during the second waves. When we see here that, the wave was high, we were still only reaching, 3,500 people. And then as it progressed on, by the year 2, we're reaching a little bit more people, but more recently, we had reached over 26,600 people. And these people, 90% of them are actually new users. So I'm showing this slide just to show how we need to be responsive in the sense that, recalling that in 2020, in May, we launched the project, we built up the information, the basic information about self-care, about mental health, about communicable disease, COVID-19 as a communicable disease. And we were tracking Facebook reach so that some of the activities that's going out, and live chat, we reached, close to 200 people. And during that time, however, we are noticing that because of the availability of information from government agency, from public health, so then people were not really seeking as much basic information. So here, the community news we find was very helpful. This is one way we collaborate. We post other agencies and other stakeholders, other collaborations, their webinars, their resources, that kind of information to support people to be able to access additional resources beyond what PROTECH can offer. But more recently, starting after beginning the second waves, we found that people really need information because there's also a surge of misinformation, and the news curation seems to be bringing a lot of people to come to our website, so that you can see here, a lot of people are trusting our website because of the kind of information that is being put out. Here's the partner showcase. We have done 21 of them, resilience dialogue, we've done 18 of them. The number might come across as small, but actually that was happening in every month, every week type of things. And there are lots of dialogue that actually go on with that. And another thing that we are very proud to actually report on is that the PACER program that actually address mental health and promote resilience, we have trained close to 400 people, and we have built capacity of over close to 30 people who can be facilitators, and we're collaborated with community agencies so that some of the agency, we actually trained the entire cohort based on staff from that agency, and we also had some community service providers who actually came through the training so they can bring this type of strategies back to their work. So in summary, I just want to highlight that what supported us to be able to be effective in the project PROTECH, there are 3 insights that we gained. Being responsive is very important. Especially at the beginning of the pandemic, we responded to community needs and we supported long-term care facilities that were devastated by the very first wave. And we support the staff there using very flexible methods that tie to what is needed there. Another part, the flexibility, is how do we become flexible with what we set out to do and change the format so that we can still reach the same goals and objectives, but using different methods so that it's more responsive to the community's needs. Integrative is about how do we work with partners, with community members, with stakeholders, so that it's not an isolated single research project that is really just there to gather data and publish data. PROTECH was actually a community-based action research, and we have partnered with many people. Our team members have gone out and respond to community needs based on seminars. We were speakers. We also partnered with others. We promoted the kind of strategies that is out there to address racism and other needs that is emerging. And when we work with these three ways of doing things instead of being rigid, then possibilities came out of it. And so we hope that today, when we gather, we'll engage in dialogue. We will be able to inform each other and generate collective wisdom that will inform our committed action together so that we could that we can continue to advance social justice and health equity beyond the COVID-19 pandemic. Thank you very much.
This is Amy Gove, President of Chinese Canadian National Council for Social Justice, CCNCSJ. As we know, anti-Asian racism is not new. It's rooted in the historical as well as systemic racism that Asian and Chinese Canadians have been subjected to since we arrived in 1800s. So in order to address anti-Asian racism, we have to call for policy and systemic changes. So CCNCSJ has been working on a number of front together with our allies and partners to bring about these systemic changes. First of all, we've been calling for the recognition of anti-Asian racism by the federal government as well as all other governments. And through this consistent lobbying, especially in the last 2 years, finally, last year, the Canadian government, federal government has included a definition of anti-Asian racism in the National Anti-Racism Strategy. CCNCSJ actually has contributed significantly to this definition. And currently that strategy is actually undergoing another revision and renewal. We hope all our partners will contribute and continue to dialogue with the Anti-Racism Secretariat at the federal level to bring about true changes that will impact not only on Asian Canadians, but other communities. We have also called for resources to combat anti-Asian racism. So money for community initiatives. So 11 million is really just a drop in the bucket. However, it's a beginning, it's a first step, and we hope that the Canadian government and all other governments will continue on the journey of that anti-Asian racism. We have also called for the inclusion of curriculum that would speak to the lived realities of Asian Canadians. And TDSB actually, during the pandemic, has released a curriculum for educators to speak on the topic of anti-Asian racism. We encourage all boards of education, not only TDSB, to continue this. And we, in fact, would call for all provincial governments as well as federal government to have standardization in curriculum that would include history of oppression experienced by Asians as well as other communities. And we also have made a presentation recently to the Employment Equity Act Review Task Force. The Employment Equity Act federally is now currently under review. First of all, the term visible minorities in the act has to be changed. There are 4 designated groups: visible minorities, women, Aboriginal peoples, as well as people with disabilities. And visible minorities just doesn't make sense. So we call for the change in term to racialized communities, because it is a term that would reflect our experience as as people that are colonized. Include additional designated groups, which we call for are LGBTQ2S plus communities, as well as faith communities, because we all know the oppression experienced by LGBTQ2S communities, as well as, you know, the impact of Islamophobia and other oppression, such as anti-Semitism. And we also ask there is enough resources dedicated to the Canadian Human Rights Commission, so that there is true support when there are victims of oppression and discrimination in the federal government or in the federally regulated industries. That the Employment Equity Act has to be positioned within the context of bigger anti-racism change federally across. And so it has to be seen as one of the strategy of anti-racism, anti-oppression. The Employment Equity Act also needs to be expanded beyond the federal government. As well, the federal government can really also mandate the federally the contractor providers with the federal government to implement employment equity as well. So those are the recommendations that we make, and we urge all our community members and allies to support these measures and to urge the federal government to make the changes in the act accordingly. CCNCSJ has been calling for the use of collection of disaggregated data. When we were speaking to the Employment Equity Review Task Force, we actually made a specific note that there is no way that we can truly assess the effectiveness of the act, of the legislation, because the act is such that the reports are filed under only 4 designated groups. There is no breakdown of each of the group. For example, visible minorities. It's not broken down into visible minority women or visible minority women with disabilities. So we don't know how many of the visible minorities are women or people with disabilities or others who have the intersectional identities. So the using of disaggregated data is critical. And Statistics Canada has been adopting more and more of the intersectional lens in releasing its data. For example, during Asian Heritage Month, it has released data on the lived experiences and realities of being Asian in Canada. And the data has shown that Asian Canadians, such as Chinese, Southeast Asians, South Asians, continue to experience higher incidence of poverty when compared to the general population, and of course, in particular, with the white population. So we urge not only Statistics Canada, but all levels of government, all providers and all institutions, be it academic as well as research institutions, to use the intersectional lens in the collection as well as in the reporting and the utilization of disaggregated data. So my plea to all of you here is that there's still a long road to go in terms of bringing about an equitable society, a just and fair society for Asian Canadians and other racialized groups. And I urge all of you to use that intersectional lens and in a policy review and analysis, and continue this fight to urge all decision makers to apply that lens to bring about equity and justice. Thank you.
Hi, okay, you can hear me, right? So I'll just briefly talk a little bit about the mental health issues. A lot of the things have been covered in some ways by Josephine in terms of what we've done, but I'll be able to talk a little bit more about it. So first, you can see that we have, in the beginning of the pandemic, put together mental health related tips on staying healthy on the left-hand side, but also a resilience self-assessment tool, kind of like an IQ test that enable anybody to go to our website to do this kind of mental health resilience self-testing that gives you a score that tells you where you're at from a non-pathological framework. So that's the kind of first thing we did. And then was the live chat that was mentioned, recognizing that people might be scared, may have mental health stress and challenges. We made that available both through telephone as well as accessing live chat through our website. We have trained over 100 volunteers rapidly to deploy it. And the main months that this was in operation was like May to October. And you can see on the right-hand side the demographics of people who've utilized different modes of communication with our live chat people. And we have reached about 177 to about 186 by the end of the year. So the utilization is not the highest, actually. I think that one of the challenge is about promotion and dissemination, that we notice a lot of people just don't know about it. But certainly for people who do know about it and access it, they were satisfied with some of the resources they were given. And partly in recognition that the uptake wasn't very high for the live chat, based on a suggestion from actually one of the town halls that was hosted, we experimentally did a series of 9 webinars of mental health series. And there was actually a pretty good uptake from 20 to over 100 people, depending on the seminar topic. So we found that this is another way of engaging. This was in the early days before there was so many webinars. And so this was successful. It was then eventually replaced by resilience dialogue and so forth. As Josephine also did mention, early on, the long-term care was pretty hit hard, and suddenly there were a number of deaths, all in a very short space of time, traumatizing to obviously residents there, but also to families as well as to staff. In some ways, also in responding to information we got from the town hall, we were in contact with one of the long-term care homes, and we offer both a group for the families as a bereavement group. There was one intervention, and then we also had like a rapid response of mounting a resilience drop-in program for staff that were going there. And you can see the uptick here in terms of evaluation out of 5, what the staff thought. We pop in at lunchtime, at their staff lunch or evening kind of snack time, so that we don't impair their work. And we were able to listen to some of their stress and also do some really short mindfulness programming or other wellness topics. And we heard some really tremendously heartbreaking stories, even from staff, about what they either witnessed or experienced themselves in being caught up in the pandemic. One of the nursing staff, for example, had to sleep in a car because the family wouldn't let her in the house in fear of COVID. And a lot of them were feeling burned out because essentially half of the staff were absent. I think it highlighted the mental health stress on the healthcare providers. So as mentioned, part of the project design include an initiative called PACER. One of our breakout groups will focus a little bit more on that, but in brief, it is an intervention that's 6 weeks long that people log on and learn mental health related information and skills and mindfulness skills, as well as issues around social justice. And they also come together in video conferencing to over the 6 weeks to consolidate the learning. And this was targeting both healthcare providers, the HCP, as well as members of the Chinese communities. So we have two pots of funding dedicated to these two populations. And the aim is to build resilience and to increase individual and collective empowerment. As you heard from Josephine, we have trained 300 to 400 people. And this is like the midway kind of evaluation for the first 100 people or so. And you can see that people feel empowered, that we have improved their mental health and resilience. I think one of the challenges we notice, for example, for the healthcare providers group, is that all of them feel initially quite reluctant to engage in this kind of activity because they feel like they are only there as a healthcare provider, so their job is to learn skills for their own clients and patients. I think that is probably one of the roots to burnout. And of course, we're not the only one active. So without going into a lot of detail, because I might even miss some, lots of organizations that we know, and part of it is captured in the partner showcase, have done a lot of community response in the mental health domain, from new staff to new programming, to online services, to educational webinars. And there were also large events, one on anti-racism and one recently on equity and mental health, that also speaks to mental health issues in the context of a pandemic. So just in closing, certainly we see from a mental health perspective, there's a direct impact of COVID. I've definitely had patients who have COVID who are stressed out and have long COVID. There are public health measures, there's racism, and there's direct impact on the social determinants of health, from housing to employment. And there's some persisting challenges, such as mental health stigma, even among healthcare providers groups not wanting to get help for themselves. There are vulnerable groups, from youth to elderly to women to intimate partner violence victims, to other marginalized groups with disability. And there's also how do we collaborate in mental health efforts? I think those are some of the challenges. So just end there, looking forward to our discussion.
In the next few minutes, I'm happy to share with you some of the lessons learned from our community engagement initiatives. We draw our lessons from the valuable experiences working with our community partners on the research team and the collaborative activities we co-organize with many of them. We also learn from the experiences organizing our community partner showcase, which have over 2,300 viewers, and our resilience dialogue sessions that have over 2,500 viewers. We have community consultation sessions that was attended by 48 community representatives, and town hall sessions that was attended by over 200 people. Reflecting on the many inspiring stories and wise practices we see during the pandemic, three key themes emerged. One area of wise practices centered around community collaboration. During the first wave of the pandemic, when our nursing home was hard hit by COVID, our seniors were dying, the staff of the long-term care facilities were getting sick, and grieving families were unable to visit and care for their loved ones. That was a really difficult time. So at that time, PROTECH, the Community Compassion Program, the long-term care facility and their family council members came together and organized various care initiatives for the staff of the organization and for the grieving family members. That experience was one of the most touching and deepening experience for me during this pandemic. Amongst the many anti-racism campaigns, there are many good examples of collaboration. I'd like to highlight two of them. One of them is development of the racism reporting tool that PROTECH worked with CCNC Toronto and CCNC for Social Justice to develop and launch. And that was an incredibly important tool that captured and documented the experiences of our community. And later on, there was the Toronto for All campaign that brought together over 20 organizations and many prominent community leaders to share the message on combating anti-Asian racism. In the later waves of the pandemic, we see inspiring examples of how community work together to champion local community vaccine clinics in the ChinaTOwn downtown, including works from networks such as the Friends of ChinaTOwn, CISO Community Center, various hospital partners, and local community organization and business partners. In the area of community care, it was really inspiring to see how our community members care for each other. Early in the pandemic, even before government resources and funding were available, many local neighborhood community groups already came together spontaneously and organized support initiatives to help people who are in quarantine and reach out to isolated seniors and people in poverty and migrant workers and sex workers who were not able to continue their work during the pandemic and bring them meals and supplies. In terms of supporting our ChinaTOwn businesses, the ChinaTOwn BIA and also many spontaneous community networks help set up and promote Chinese businesses online to combat the hardship they face, both in terms of the pandemic overall impact, but also the racism backlash against Chinese Canadian communities. In terms of supporting our workers, there are many initiatives organized by the Chinese Workers Network, the Labor Council, different business organizations, social justice groups, and health and safety organizations working together to promote a safe and discrimination-free space for our workers, advocate for paid sick leave, and other wage protection and income support measures. The third area of wise practices are seen in the ways that many community service organizations adapt and innovate their service deliveries. These include developing new ways of providing service online and developing training and workshop contents and programming on a virtual platform, organizing drop-in and social spaces online, as well as using various technology, whether it's basic phone outreach or whether it's Zoom meetings or other fancy ways of gathering to enable people to stay connected and continue to plan, support each other, and do their work. But most importantly, it was important to recognize that not all of our community members have ready access to technology. So many organizations actually took the initiative to fundraise and to provide the tools, the data plan, and training support for the community members who do not have ready access. In terms of HR or human resource adaptation, we saw leadership in some organization to integrate family members as essential caregivers and to systematically redeploy their staff in different departments in response to changing needs. We also see innovation in how different groups utilize both traditional and social media to not only promote their own events, but to more utilize them to promote awareness and service navigation skills for the community. And last but not the least, we see lots of collaborative creative projects such as Long Time No See ChinaTOwn or Reimagining ChinaTOwn that brought together artists, researchers, businesses, community agencies, and grassroots activists to help bring communities together to revision and redevelop our community space during the many different phases of the pandemic. So reflecting and revisiting some of these resilient strategies and wise practices from our communities, it really gives me a sense of hope. So I hope that in our follow-up discussion today, we can draw from their inspiration and develop more action plans to sustain and further advance these important initiatives. Thank you very much.
Hi, everybody. It's great to be here. My name is Linda, and I'm an assistant professor at the School of Interior Design at Toronto Metropolitan University. And today we'll be talking about the power of imagination to reimagine both the future, but as well as the present and the past. I wanted to talk in particular about speculative fiction writing and social dreaming as a way of enacting change. So I wanted to actually start by acknowledging the work of others and other communities that have come before us, and in particular, the importance of the Black and Brown women in this movement who have organized around change through writing and social dreaming, including Adrienne Marie Brown and Walida Imarisha, as well as Octavia Butler. And they share a belief that science fiction is for everybody and that all organizing is science fiction. Social dreaming is organizing. And so I'd actually like to start us off with a clip from Adrienne Marie Brown and Walida Imarisha themselves.
Yeah, we absolutely believe that all organizing is science fiction. So we think that anytime we try to envision a different world, a world without poverty, a world without prisons, a world without capitalism, without war, we are engaging in a practice of science fiction. But we think that when we can dream those realities together, that's when we can begin to build them right here and now in this time. And so we think that our movements for justice are incredibly great at critique, which is wonderful, and we need that, but we also need to be able to offer alternatives. So we know what we don't want, we know what we're fighting against. What do we do want? And I think one of the things we really focus on is the idea of being unrealistic in our dreams. I think in our organizing, we're often told you have to go for what's realistic. All social change that's deep and transformative was utterly unrealistic at that time.
And so how might we think about this kind of unrealistic social dreaming as a way to combat racism and also better understand our own relationships to structural violence? And so one of the things we've been doing during the pandemic is a series of community-based speculative fiction writing workshops. And here, writers were asked to be unrealistic in their dreams. And the writers didn't have to be professionally trained in writing. It was open to everybody, anyone who's part of the community. Social dreaming is for everybody. And the rules could radically break from, things that would be in the realm of possibility today. People could have superpowers. There could be, extra otherworldly beings and creatures. But the workshops focus on the questions of change. So who seeks change? Who seeks to prevent change? Are there others in the world seeking different kinds of change? And of course, this was also set in the context of COVID-19. And so we looked at how did new social or political systems take root following the changes that were made after the COVID-19 outbreak. What were the assumptions that we can make about this society in 2050, which is the year the writing was set in? And we are currently working on producing virtual worlds for each of the stories. And we're working on a short documentary that will be coming out fairly soon. And just a shout out to all of the contributors and authors who've been a part of this project. The next project I want to talk about is Planting Imagination, where we've also been reimagining, not just through writing, but actually reimagining ChinaTOwn through actually building in ChinaTOwn, designing and actually building and shaping space. And in this project in particular, it's not just about how we design, not just about designing ChinaTOwn, but also reimagining the process of design in particular, where in the ladder of participation, most architectural projects at best allow maybe participation from community in the design process through community consultations, which are actually a form of tokenism on the ladder of participation. And we've been reimagining how we can get closer towards citizen control and co-design in this process. And we're doing this actually through reimagining how to do this in VR and how technologies can actually help us transform and give access to new ways of working together. And we're also challenging some of these maybe more traditional uses or neoliberal uses of virtual reality and looking at how we can democratize this technology and in that process give more access to being able to be part of the design process and shape the future and dream about the future. And so we've done this through a number of different platforms. This is a platform that we've developed that's a web-based, browser-based virtual platform where folks can redesign the Cecil Center garden and reimagine what it could be in the future. And so here's an example of one reimagination. And this is now in VR, in virtual reality, where you can also see it linked to what is there today. And you can kind of toggle between real life, as well as, if you click on this button on the screen now, reimagined future. And it's been a really great way to just have discussions around what are our values, what do we seek for the future, but also give access to the design process. And so in this slide here, you can see the project in augmented reality. So this is on-site, overlaying the design on the site. And with all of these new technologies that we have now, it's very easy to be able to actually give access to everyone, to be able to envision their dreams, to see what they look like, see what they feel like, walk through them, be in those spaces. And in doing that, get a better sense of what that reality could mean, and also what we would want. And also, if we disagree about what we might want to build in ChinaTown in the future, how we can, bridge that and come together. And then here is also an example of collective virtual reality. So you'll see that this is in VR, not AR, but we're in actually a large cylinder space, and we can actually be in this together and working through VR together. So just a short prompt around the power of reimagining and the impact that it can have on the present moment, even if you're thinking about the future, even if you're reimagining the past, what that can mean as that transforms our present moment. And so as I close this short presentation, I just invite you all to embrace that power and to radically reimagine what today could be, and so what tomorrow could be, and even how reimagining the past and how we understand the past can also shape our present moment together. Thank you so much.